This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. We are glad to have you with us. Due to COVID-19 this week in Arkansas, we saw hospitalizations reach an all-time high. We saw the death toll climb, and a raging debate over whether or not to have mask mandates in public schools continued. I caught up with Marcy Doderer, CEO of Arkansas Children's Hospital, for her perspective on the growing crisis. We are about to send 400,000 Arkansas school children back to school in a week, if not sooner. What's your prediction for what's going to happen?
Well, we are a little anxious at Arkansas Children's about what will happen if our 400,000 or so school children don't really live by the known and proven rules to make it through a pandemic like COVID. So we have said from the very beginning, everybody, school kids included, need to wash their hands, watch their distance, wear a mask. We now have a fourth thing in our armor to protect children, and that's a vaccine. So anyone who's eligible, we're really encouraging them to be vaccinated. If we were in a perfect state, an optimal state in Arkansas, and all those things were in play for every school child, I wouldn't be as anxious. But right now at Arkansas Children's, our hospital is full, not just with COVID patients, which we are seeing more and more hospitalized children for COVID-19. But our hospital has many, many sick kids with respiratory illnesses that we don't usually see until wintertime. And the fear is if you put all those children back into classrooms and they are not wearing masks, not watching their distance, and the people around them aren't vaccinated, that we could have an even greater public health crisis on our hands.
Tell me what the decisions are that you're having to make on a daily basis. I know you guys are close to max out on bed space. You've got resources that are stretched thin. What are the decisions you're having to deal with on a daily basis?
There's a few critical points that we're watching daily. Staffing obviously is one of them. And if you spoke to any hospital CEO in the state of Arkansas, it's probably one of their number one concerns. We are facing a global nursing crisis in terms of shortage of workforce. So I saw a statistic this week published by the Arkansas Hospital Association, something like 130,000 vacant nursing positions across the country. So staffing is a big one. Now, it varies by the kind of staff. So we're really, really granular in our understanding of where our nursing workforce is deployed between our med-surg rooms, our NICU versus our PICU, outpatient areas, the COVID testing center, those kinds of things. But there are some physical plant capacity challenges that we haven't been overrun with, but we are watching very closely. We have a fixed number of negative pressure rooms, the kind of room that you want to put a patient who is positive for COVID-19 and other very infectious diseases in. You don't want all of your rooms to be negative pressure, but we have a limit on how many we have. And so this morning we were at about 85% of those rooms filled with patients. It doesn't leave you a whole lot of wiggle room through the course of the day as you manage admissions and discharges. Our facilities team is working to convert some more patient spaces to negative pressure rooms. So we're investing in that plant redesign right now as we speak. And so those things are really a challenge. The other thing that we assess really throughout the course of the day are any kinds of procedures that will require ICU stay. So an admission coming tomorrow that is expected post-surgery to be in our ICU. Our ICU team, our chief medical officer, our surgical team are in close communication to ensure that we'll have the bed availability that we need when the child comes out of surgery. And then we evaluate any request to transfer patients into our facility just to make sure we can take care of the kids already in our ED, the kids coming from Northwest Arkansas facility to here, and then those coming from other places. So there's an entire teamwork process in place to really evaluate the request and the timing and how we'll be able to take care of that from both a bed and a staffing standpoint.
I don't know what all goes into a negative pressure room that you were describing. You're having to convert some space to. I do know that it's not something you just flip a switch and it automatically happens right there. So there's some planning that goes involved with that. How close are we to needing massive temporary bed space, like what we were talking about a year ago when we were kind of uncertain about the the surge of COVID-19 and how bad it may get, we were talking about setting up temporary facilities at War Memorial Stadium, for instance. Are we having those conversations yet, or are we not there yet?
Well, the healthcare industry, the leaders through the Arkansas Hospital Association, and those of us who participate with the governor on the governor's task force are certainly already having those conversations. And I would say we've had tremendous support from Governor Hutchinson to facilitate dollars going first to Baptist Health so that they can reopen some facilities that they have access to and manage to increase bedside across the house, or across the state, excuse me. And I think when their 3 facilities are open, that will be 156 new hospital beds available in the state of Arkansas to help with COVID-19 adult patients. Other hospital systems in the state are also working with the state government to say, are there funds that can help us open additional capacity as well? The really rate limiting factor for every one of us, though, is actually not the physical number of beds. At Arkansas Children's, we have some bed space, we could put more kids in, but it goes back to that staffing challenge.
Mm-hmm.
And we are all really pushing our teams to their limits at times. With no ready supply of extra staff, our teams are working extra shifts themselves. They're not taking the kind of vacations we would like them to have. They continue to be the true heroes of this pandemic. Those bedside nurses, the respiratory therapists, the radiology techs, every one of them taking care of these patients. So the state is also helping us frame the argument through FEMA, the federal government, and through our own kind of processes to actively and aggressively recruit traveler nurses. So those are part-time contract labor nurses into the state of Arkansas to help us through that. If we can get all of those nurses here, I think we'll be able to expand beds as we need them as we go. But it's the nursing that's really kind of the rate limiting factor right now.
Well, still, you're talking staffing, you're talking the physical infrastructure that you need for more bed space. Those are expensive solutions when there are some less expensive solutions, such as vaccines and masking and social distancing and washing your hands. How do you convey the fact that it's so much more expensive and so much deadlier to do it the way that we seem to be heading versus the way we could?
I think it's a bit of a political tightrope right now, being very frank. We in healthcare have complete trust in our physician and our scientists in this country. And so we believe in the science behind the vaccine and are advocating heavily that anyone who is eligible should get vaccinated. We are supportive of the vaccine companies continuing their clinical trials to lower that age to 5 and remain hopeful that good news will come late in the fall or early winter that the vaccine will be applicable to children down to the age of 5, and hope someday it's just a routine part of our vaccination stance. We have not gone public with any kind of cost benefit analysis that says here's the cost of vaccinating versus the cost of redoing a facility. I think mainly because at the end of the day, we are here to take care of sick people, and we certainly have all of our efforts around prevention and wellness, but when a child shows up at our door ill, it is our responsibility to figure out how best to take care of them. We are getting some help financially from the state. The Legislative Council did approve a bolus of monies to hospitals to support the retention and recruitment of staff to help us through this. And I think that will be helpful to particularly many of my colleagues who lead smaller facilities where their financial margin is a little more in the balance than the security I have at Arkansas Children's.
I'm going to ask you a political question. You'll have to walk the tightrope on answering this one. So you've testified before the state legislature ahead of the special session. I know what you've shared with them. I know some members have received it well. Some members have rejected what you have put out there in terms of the science that you're dealing with. Do you feel like that it has changed some legislative policymaker opinion? Do you feel like you're making progress in that area? Or do you feel like people are dug in deep and are just not moving their positions either way?
I don't believe we made a whole lot of progress with the legislative agenda in the last couple of weeks. I think we are making much more progress in more of the public spaces around our own employee base choosing to be vaccinated, the response and conversation that's happening in the broader community. You know, all the school districts that are moving quickly with their school boards to mandate masks in the coming week. And I think at the end of the day, those actions will provide a level of safety to our children, regardless of the way the legislature acted during the spring session. So we have some strong advocates at the state legislature, and we have some strong opponents. And I think at the end of the day, we'll continue to beat our drum around the safety for kids, and we'll work through and with and also around the process to ensure we can help school districts be safe as they open their doors, help our health systems be safe, and certainly help parents understand what's available to them and to their children to provide a safe home environment for their kids.
Last question for you. It's a little bit of a crystal ball question, but tell me how you kind of expect us to navigate this current surge that we're in. Do you see any kind of light at the end of the tunnel, or do you think it's still dark at the end of that tunnel? And do you expect additional surges as time goes on because of the mutation of the virus, or kind of give me, I guess, that prediction?
Well, and just to put the caveat out there that I'm not a physician myself and I'm not a scientist, but certainly my physician colleagues and fellow executives on my team and the things I read, that we've got a long way to go in this country, and particularly in the southern states in this country, as long as our vaccination rates stay as low as they are. I think Arkansas today is at about 43% fully vaccinated in the 12 and up group. It's a long way towards, we still have a long way to go to reach herd immunity at that 75 or 80%. And, you know, I had an interesting conversation with one of my physician colleagues last week who had done a lot of reading recently about the Spanish flu pandemic of 1918. And it was kind of an aha moment for me. We always think of it as that 1 year, 1918. But according to her and the reading she's done, and I guess checked it with some other people who've read deeply about that time frame, it wasn't a 1 year pandemic. It was actually a 3 to 4 year pandemic to really move to a safe space. And they didn't have vaccines then. So that might have been part of their lengthy problem. We have vaccines, but they weren't nearly as global as we are. And we have still people just moving across this globe every day, right? And so what we are talking about at our team at Arkansas Children's is thinking we've got another, this whole fiscal year, July through June, we're going to run it like we did last year, where masks are mandated, where employee safety is of utmost concern, and they will have all the PPE they need. And we will manage visitors, and we will manage traffic and throughput and flow in our facilities, because I think that virus is going to be in and among us for at least another year. That's Marcy's point of view. And remember, I'm not a physician.
Yeah, well, I tend to agree with you from what I have read, the experts that I have talked to, and just kind of my own observations. And by the way, on that Spanish flu, was multi-year like you're talking about. The death toll in Arkansas was a little over 7,000, and we're at about 6,400 right now. So we are coming close to similar proportions in terms of numbers.
Of those 6,400, 3 are children.
Yeah. Well, let's hope that it does not grow any higher than that. Right. So, right. All right. She's Marcy Doder. She's the CEO of Arkansas Children's. Thank you so much for your time. Always good to catch up with you. Appreciate your expertise.
Thank you for listening. Good to see you. Take care.
All right. We'll be back with more right after this.